Is grinding wearing you down? Good thing it's Dental Hygiene Wednesday. Hi, I'm Christina. I'm the lead hygienist here at Dublin Dental Care, and I want to welcome you to our Dental Hygiene Wednesday. Every week we like to cover different topics or products we believe are important for our viewers and for our patients to know about, and give them helpful tools or information to help keep their mouths nice and healthy at home when they're not here with us. Last week we actually took a break to celebrate 4th of July with our friends and family, and hopefully everybody enjoyed their 4th of July and ate some good food and had some great company and watched some awesome fireworks. This week we are talking about something that we see a lot with our patients here at the office, and that is evidence of grinding or bruxism. And what grinding is when your teeth come together. A lot of times it happens at night. People will grind them back and forth and wear them, or front and back, and start to wear the tooth structure down because of the pressure of the enamel on the tooth to tooth. So this is definitely something that we look for when you come into the office, and if we see signs of it, we often recommend using what's called a night guard. And this is very important. If we do recommend it, it's because we feel that it's necessary for you to wear it so that you don't damage your mouth anymore. The night guard is super easy to use. You come in, we make impressions of your teeth, both upper and lower, and do a bite registration, and this is to make sure that everything is going to fit properly in your mouth. And then all it is a thicker piece of plastic with a more cushiony piece of plastic on the inside that you put over your top teeth at night, and it hugs on and it fits tight. That way you don't lose it in the middle of the night or try to swallow it. We don't want that to happen. And what this does is, instead of allowing the enamel or the tooth structure to rub back and forth and wear each other down, this cushions it so that you are not having that happen. With grinding or bruxism, there are several things that can happen. Like I said, your tooth structure can wear flat, which is called attrition. A lot of times the sharp canine teeth can wear flat, and those are definitely signs that you're probably grinding. So that's stuff that we look for. Sometimes you can grind so much that you expose the inner part of the tooth, which is not something we want to happen, because that tooth structure is more sensitive and can be broken down and get cavities a lot quicker than the enamel can. You can also get recession. So if you're already struggling with recession when it comes to your tissues, you know, grinding and bruxism is something that we want to try to keep from happening. So the recession is where the tissues, instead of being nice and tight and shaped to the tooth, starts to go up or recede, and it exposes part of your root. And again, the root structure doesn't have that strong enamel, so the root can break down a lot quicker than the enamel can. It's also more rough than what the enamel is, so plaque can stick to it, calculus can start sticking to it, or tartar, which causes the tissue to become irritated, and it's not something that we want to happen. And then you can also cause abfraction, which is where you're starting to get a little wedge in the tooth, and we don't want that either, because again, that is a huge plaque trap. You know, it can just gather in there. It also exposes the inner part of the tooth. So definitely things we want to try to keep from happening. You can also be doing what's called clenching during the day. If you're stressed out, if you're at work and you just feel yourself tightening up your muscles here, that's called clenching. That's something, if you are doing it, we want you to be aware of and make sure that you're trying to stop yourself, because again, over time it can cause these types of things to happen, and it's not something we want to do. If you aren't sure if you grind, some things that you can look for, like I said, is wearing of the teeth. Also, if you're waking up in the morning and your muscles here on the sides of your face are sore or tight, and you know it's a little tender when you first wake up, those are signs that you're grinding. Also, if your partner says, you know, during the night you're making some weird noises, that can also be signs that you are grinding. So if you feel like there's a possibility that you're grinding, come in, see us, we'll take a look, and if you are, we'll give you some tips on how to keep that from happening, and probably recommend the night guard so that you don't cause this type of damage to your teeth. I want to thank you for joining us today. Like always, we always love having you guys view our videos. If you have any questions or comments, feel free to post them on our Facebook or YouTube video. If you have any questions for me personally, you can email me at christina@dublindentalcareohio.com. And then also check out our website. It's dublindentalcareohio.com. You can even schedule appointments to come see us. If this is a question or concern you might have, we'd love to bring you in and check it out. Have a great week, and hopefully you guys are enjoying your summer.